I am Glyce Duero, and today I'm going to perform the open gloving return demonstration. The use of gloves reduces the risk of contaminating the healthcare workers' hands with blood and other bodily fluids. It also reduces the risk of germ dissemination to the environment, as well as it reduces the risk of the transmission of microorganisms and harmful pathogens from the healthcare workers to the patient and vice versa. So prior to the conduct of the procedure, I have performed already the hand washing, as you can see here. We must remember that the use of sterile gloves does not replace hand washing, and so we must perform hand hygiene before and after every procedure. Okay, so here I have prepared my sterile gloves to ensure that the gloves are of the right size and the packaging has no tear and stains. Okay, it is important to ensure that the gloves I have chosen is fit for me to ensure that the user comfort and avoid contamination. If the gloves are too big, then it would be harder to hold objects and it would be easier for germs to get inside. If the gloves are too small, then it is most likely to get ripped, or if not, it may cause decrease in blood flow to the fingertips and might result to the pain, numbness, and constraint in the finger and hand movement. Okay, so now I'm going to remove the outer wrapper of the package. We must do this carefully by peeling the sides and be careful not to spill the inside contents to keep the sterility of the gloves. And then we must grasp the inner package and place it on a clean and dry flat surface because moisture can contaminate the gloves and the area must be at waist level because any object held below the waist is considered contaminated.
Open the wrapper of the gloves, taking into the consideration that the inside wrapper and the gloves are sterile. For it to be folded properly, turn the bottom edge to hold the wrapper. It is important to remember that with bare hands, we can only touch the inside part of the glove to avoid contaminating the glove and to ensure its sterility. Here, this is the inside of the glove, the cuff that has been folded up, and this upper part are the sterile sides of the glove, so we must stay away from this part so that we can avoid dropping anything onto it. Using the dominant hand, pick up the cuff of the right glove with your left hand and then slide your right hand into the glove until you have a snug fit over the thumb joints and knuckles. Your bare left hand should only touch the folded cuff and the rest of the glove remains sterile. Now, you can manipulate or adjust the gloves to fit your hand. And be sure not to touch the sterile area. Okay, so after doing that, we're going to clasp our hands away from our body. This is done to avoid accidental touching of non-sterile objects and the front of our uniforms. Now is to remove the gloves. All we have to do is first remove the glove of the dominant hand by pinching the glove at the palm area of our hands and remove it. And now for our non-dominant hand, we are going to slip our finger under the glove or to the inside of the glove and remove it like that. Lastly, now we can discard this glove and perform hand hygiene again after doing this. This has been Glyce Duero, your student nurse.